Sa rounds ng ospital, hustle di magtigil. Laging inaalala ang bawat detalye pilit. Pasyente pamilya, sa kanya'y mahalaga. Kaya bawat check-up, laging may pag-asa. Si Doc Chris, tas Bobby ang para sa pamilya, laging ready. Kung kailangan mo ng consulta dito, pumunta sa klinika, yun ang totoo.
Punta sa klinika at magpakonsulta. Hi guys, Doc Chris here. Welcome to the Off-Duty Doctors Podcast. And I am your host, Doc Chris, Dr. Shaum Orpia, a family medicine specialist. Last video natin, nag-focus tayo sa Omnibus Health Guidelines. Introduction pa lang. Types of prevention. Mag-focus naman tayo sa mga underlying information na kailangan natin malaman about prevention. No? Start with self-care. Yun yung unang topic natin. Interesting to kasi self-care it should be practiced by all. Hindi lang ako, hindi lang kayo, okay? Mga kasama nyo sa bahay, mag-focus tayo sa adults na kasama nyo sa bahay. So kung nadaanan nyo itong video na to, tignan nyo kung nagagawa nyo ba ito araw-araw. Okay? So this is self-care that should be practiced by every Filipino. So kung hindi nyo nagagawa, reflect, baka pwede nyo i-integrate sa inyong regular habits, no? Starting after ng pagpanood nyo ng video na to. Okay, liitin natin para mas maganda. Yan. Okay, maliit lang yung video. Mas maganda yan. Okay, self-care. Uy, nag-blue. Okay, self-care, encourage adults to observe the following health practice. So again, kung kaya nyo ito integrate sa inyong daily routine, better. Dental care. Pagsipilyo, okay? Proper dental care by brushing should be twice a day using the right amount of fluoride toothpaste. Now, may right amount of fluoride toothpaste. I think lahat naman ng toothpaste natin already has the right amount, okay? Pero if you have to be more nitty-gritty or specific, it's 1,000 to 1,500 parts per million ata to ppm, which is recommended to be the entire brushing surface of the toothbrush. So kung meron kayong toothbrush, yung buong surface mismo ng toothbrush, dapat may toothpaste yan. And then do it at least twice a day. At least, no? Pwede naman thrice a day, pero make sure na wag naman masyadong makaspang. Baka kasi magkaroon ka ng, masugat naman yung gilagid mo. So hindi naman natin gusto. Glossing at least once a day and avoiding rinsing with water after toothbrushing to optimize preventive effect of fluoride. Okay? So, make sure na yun din, it will last na yung pagtutoothbrush mo. And make it a habit every day na twice. Ang pagsisipilyo. Okay? Visit your dentist for oral prophylaxis and oral examination every 6 months. So, you have to be committed na magpa-check up sa inyong dentist every 6 months for oral prophylaxis. As advised by your dentist, preferably, kung kailangan ng reassessment, meaning may mga dental caries ka or sirang ipin, it should be preferred na 3 to 4 months regular visit sa inyong dentist. Okay? Kung wala naman at oral prophylaxis lang to, twice a year or 6 months interval would be fine. Okay? How about diet and nutrition? Diet and nutrition, laging tinatanong yan ng mga pasyente natin. So, we adhere to a healthy diet pattern visually guided by the Pinggang Pinoy. Magandang idaanan natin ng Pinggang Pinoy on a different video. Pero, usually ito yung sinasabi namin na sa 9 na pulgadang pinggan or 9-inch plate, it should have the following contents, no? So, ang Pinggang Pinoy should have at least half of it would be from fruits, vegetables, and a good 1/4 of it would be from whole grains. Another 1/4 would be from protein source of fish. Pwede naman lean meat, so avoid fatty meat, and low-fat dairy products. Siyempre, meron din dyan yung tubig. Now, those nutrition or pagkain should also be fortified with micronutrients. It includes your vitamins, no? Meron siyang enough vitamins that would sustain you in your everyday activity. Then, Yun nga, kaya siya lean meat. You have to watch out for meat that is low in cholesterol and saturated fat. So pag sinabi ng saturated fat, iwas na tayo dyan sa mga deep fried food, trans fat like your french fries, iwasan na yon. With the avoidance of trans fat, yun na yung sinabi ko. Okay? So, preferably lean meat, ang nababanggit din namin noon, laki lang siya ng posporo. Now, the best advice for diet and nutrition would always be coming from a registered dietitian. So, if you have a friend, like ako, may kilala rin ako na registered dietitian, you could arrange a consult with them para ma-provide kayo ng a precise diet prescription. And pwede din ang lifestyle specialist, no? Lalo na dun sa mga nakatapos na ng lifestyle medicine. Pwede rin silang maging guide ninyo for proper diet prescription. Okay? Aside from that, syempre, you have to watch your daily salt intake. It should be less than 5 grams per day. Now, Doc, paano yan? Paano ba natin yan measure 5 grams? Di naman kaming kumakain ng 5 grams ng asin araw-araw. So, you have to visualize na lang na just under 1 teaspoon of table salt per day. So, teaspoon, yung kutsarita, dapat less lang dun ang alat or asin na nagagamit mo sa isang araw. And use of iodized salt is more preferred. Okay? So, preferably kapag ganyan, isipin mo kasi kung kumakain ka ba madalas na may toyo or soy sauce. Mahilig ka ba lagi sa bagoong? Mahilig ka ba lagi sa patis? Mahilig ka ba lagi sa sinigang mix? Mahilig ka ba lagi sa MSGs? Okay? Mahilig ka ba lagi sa chichirya? Masyado na mataas yung alat na kinakain mo kada araw. So you have to minimize that. Iwasan na natin magdagdag ng mga sawsawan na nakakadagdag ng yung flavor, no? Find another alternative. Pwede naman tayong mag-switch sa alternative na lime or calamansi. Pwede naman ginger, pwede rin other forms of spices na pwedeng magbigay ng lasa sa pagkain natin. Ang goal natin is ma-minimize ang salt intake. Okay? Another, minimize to no intake of processed foods. Now, we are guilty, most of us, no, sa atin sa mga Pilipino. We usually eat canned goods, we eat processed meat like yung longganisa, hotdog, tocino, tapa, hotdog, burger patty, ganun. Those are processed foods, okay? Embutido, okay ka. Sarap sana kainin, lalo na sa mga handaan. Kaso lang, yun nga, you have to take it only by the minimal. Minimal, guys. Minimal. Maliit lang. Or better yet, wala at all. Kasi processed foods, they tend to be more unhealthy kapag madalas natin kinakain. Lalo na, though readily available, ang canned goods. Okay? It has a lot of salt and magiging problem siya in the long run. Malaki ang chance na magkaroon tayo ng hypertension kasi lagi tayong kumakain ng maaalat na pagkain. So, bawas-bawasan natin. Better yet, iwasan natin kumain ng processed meat. Isa pa, syempre, paborito ng lahat, pancit canton, noodles, ganun. Mataas, may sodium intake yon, may sodium content yon. Pag nagdagdag ka pa ng pancit canton tapos kumain ka pa ng salted egg, alat-alat na talaga, di ba? So, kailangan hinay-hinay. Better yet, bawasan or mawala na sa inyong diet. Okay? Minimal to no intake of sugar-sweetened food, beverages such as donuts, cookies, or sweets, fizzy drinks, juice, and with added sugar. Pag ganyan, ano bang sabi natin dyan? Iwasan na natin ang mga patatamis na inumin. May nabalitaan tayo sa isang, I think it's Ormoc City, they banned soft drinks already. No? So, that's a huge accomplishment and it will lessen the risk of diabetes sa kanilang lugar. I hope there are other areas in the country na magkaroon din ng ganung mga policies kasi it will help. Even in your establishment sa mga trabaho nyo. Try not to drink soft drinks sa lunch or sa mga merienda or sa mga office meetings nyo. It will help lessen the risk of developing diabetes sa inyong trabaho. Take note, kung may sakit kayo sa inyong trabaho, may possibility na ma-reduce yung workload and efficiency ng inyong company. Okay? Take it from me as one of a occupational health physician. No? So, better na mas healthy yung mga trabahador and away from diabetes and hypertension para hindi sila umabsent. Okay? So, minimize or to no intake of sugar-sweetened foods or beverages. Okay. Tingnan natin timer natin. Nakailang minutes na ako. 10 minutes. Okay. Nandun pa lang tayo sa nutrition. Last ko na siguro ang exercise before we end this second part on general wellness. Exercise dito sa part ng to, very brief lang. Perform moderate to vigorous aerobic physical activity. Moderate to vigorous, that is usually examples are jogging, brisk walking, cycling, vigorous activities, basketball, contact sports like judo, taekwondo, ano ba yung mga contact sports, volleyball, okay, ball games, na kailangan gumagalaw lahat ng muscle groups. Okay, at least kapag vigorous activity, 75 minutes. A week of vigorous activity is the minimum. Pwede naman siyang mas mataas doon kung kaya ng katawan mo. Okay? Kung moderate activity, at least 150 minutes per week. Pero pwede nyong itaas yan kung kaya, kung kaya ng katawan mo. And unless may mga underlying kayong health conditions. If you have hypertension, you have an underlying heart disease like coronary artery disease, okay, or diabetes, ganun, make sure to check your doctor before doing any physical activity routines and ask for their advice. Kasi mamaya, nag-start ka ng vigorous activity, may sakit ka pala sa puso. It might lead to a more serious complication. And you know what I'm talking about. So, kailangan magpatingin muna sa doktor. Pero kung you have no underlying conditions, feel free to do your exercise, but take it slow and then try to increase your endurance little by little. Siguro every 2 weeks, try mong itest yung sarili mo kung kaya mong itaas. And that will help you, okay, sustain a good exercise routine. Replace sedentary time with age-appropriate physical activities of any intensity. So, kung may time ka lang na nakaupo, nakahilata sa bed, nanonood ng TV, naglalaro sa cellphone mo, nagsuscroll lang sa social media sites, palitan mo. Take the bike, mag-bike ka muna 15 minutes, take a walk, okay? Better yung physical activities na gumagalaw. Now, kung may trabaho ka na wala kang oras para mag-exercise, we have what we call, non-exercise active thermogenesis or your NEATs. Kapag NEATs na activity, ito yung mga activities sa trabaho na pwedeng mag-burn ng calories. Okay? And now, think of an alternative. Let's say you're working sa trabaho mo and may elevator. Better use the stairs. Gumamit ka ng hagdan. Okay? At least yung physical activity, yung up and down. Though mapapagod ka, but that's the purpose of your physical activity, di ba? Take time to rest din after you walk. Okay? And then, hydrate yourself. Pinakamahalaga, you're doing it correctly and meron kang goal. Okay? Yung goal mo dyan is to have a good physical activity routine and, syempre, self-care. Importante na nagagampanan nyo ang pangangalaga sa inyong kalusugan kasi nagsastart yun sa sarili nyo. And self-care is very much important. Okay? Diet, nutrition, exercise, dental care, those are just but a few. No? Marami pa tayong pwedeng gawin. And later on sa mga next videos, dadalan ulit natin yung mga other aspects of self-care. Okay? So may mga na-touch naman na tayo sa video na to. Hopefully may nakuha kayong mga magandang impormasyon and tidbits about self-care, okay, from our Omnibus Health Guidelines. Kung may mga questions kayo, you can message me, leave a comment down below. And again, thank you sa mga dumaan and nakinig, and I'll see you all on the next video. Again, this is Doc Chris, signing out. Bye-bye!
Sa raw sa ospital, hassle di magtigil. Laging inaalala ang bawat detalye pilit. Pasyente pamilya, sa kanya'y mahalaga. Kaya bawat check-up, laging may pag-asa. Si Doc Chris, tas PBMD, para sa pamilya laging ready. Kung kailangan mo ng konsulpo dito, pumunta sa klinik.